Health insurance is now mandatory as contained in the National Health Insurance Act enacted in 2022. The National Health Insurance Bill also provides for all states of the Federation to domesticate the health insurance scheme. In the nation's capital, through the FCT Health Insurance Scheme, the FCT administration is keen on ensuring every resident is enrolled.
I'm happy that there's a National Health Insurance Scheme, which means the country as a whole understands the essence of health insurance. In trying to increase the uptake of health insurance in the FCT, we are looking at the whole value chain. One, ensuring there's human resource in health to offer quality health care. Secondly, the medication you need to take care of you, as long as that disease we are diagnosing or what we are taking off is part of your package. We have realized that we have gotten reports that most times they ask us to go and buy, they ask us the rights, and this is not encouraging. This will not give us the outcomes that we want. So we're looking at the value chain, digitalizing our processes, medical records, drug revolving fund, and the health insurance scheme.
Health insurance, as a global phenomenon, is regarded a necessity to protect families from financial hardship of out-of-pocket expenditure on healthcare services. The scheme ensures equitable distribution of healthcare costs amongst different income groups. To maintain high standards of healthcare delivery services, health maintenance organizations HMOs licensed by the National Health Insurance Authority are saddled with the responsibility of ensuring access to quality health care services for enrollees using various health institutions.
You must regularly do what we call quality assurance. Quality assurance is you visit the hospital, you go there, they check the folders, make sure that the hospitals, we call them providers, are giving the stipulated treatments according to the treatment protocol of NHI. That's the guideline.
An employer who is satisfied with a health plan meant to be provided for its employees by a particular HMO pays once an agreement has been reached.
At the Garki Hospital, one of the 14 district hospitals in the nation's capital, Abuja, and here over 50% of their patients are covered under the National Health Insurance Scheme, NHIS, now NHIA.
I enrolled with Novo. Novo is my HMO.
So what's your experience like?
My experience with them is that they are not doing exactly what they promised us.
There are some days that things go well, and there are other days that when you come, you have to wait for so long before they attend to you.
Like the last experience I had was the day they admitted my son. We were discharged in the morning. Before we got approval for us to make the normal payment, it took us almost the whole day. I made a call, and it was after my call that it was approved. So like now I'm waiting for approval. I called my HMO. They said the request has not gotten to them.
At FMC Jabi, I also sought to find out the situation.
Before, when the process was manual, it was quite a long wait.
It's not all of the HMO that causes delay. So others ones are prompt in terms of providing a code easily.
Constantly monitor our HMOs. The hospitals, the government hospitals, the hospitals empaneled have to ensure it is our responsibility to ensure that there is medication and there's qualitative health care available.
There are more than 70 accredited HMOs registered nationwide. Findings, however, reveal that inadequate manpower and facilities to fast-track the process on both parts of health maintenance organizations and healthcare providers are leading challenges that need to be urgently addressed to ease the process.
Well, while the tales of frustration continues from government employees enrolled under the scheme, many say the work is on the regulatory body, NHIA, to checkmate the activities of the HMOs that are not prompt to responding to requests to fast-track access to care for patients. In Abuja, Hakimat Aliu reporting for Dateline 360.